The latest data from the American Academy of Pediatrics shows children make up more than a quarter of new COVID cases nationwide. At the same time, Pfizer has submitted a request to the FDA for emergency use authorization of their COVID-19 vaccine for children ages 5 to 11. So what do parents have to know?
TV is asking our team of experts tonight. Dr. Octavio Ramillo, the chief of infectious diseases at Nationwide Children's Hospital, joining us live. Doc, we appreciate your time this evening. Let's start with an update on what you're seeing there at Children's Hospital tonight and cases there.
Yeah, we're still seeing, unfortunately, a number of kids. On average, we have 17, 18 kids hospitalized with COVID at Nationwide Children's, and 4 of them are in the ICU. So it's important to mention that, yes, our experience is similar to other parts of the country, and unfortunately, we continue to see a number of kids with severe infection that require hospitalization. It's important to mention, and this is relevant to the vaccine discussion, that half the kids that we see hospitalized are previously healthy. So it's very difficult to predict who can get infected that is severe enough to require hospitalizations. An important detail, sorry, go ahead.
I was going to ask you if most of those cases are the Delta variant.
Yes, over 90% of the cases that we are seeing now in Columbus are the Delta variant. You are totally correct.
Okay. What will go into the emergency authorization process for the Pfizer vaccine for 5 to 11-year-olds?
Well, the first thing will be the vaccine will be reviewed by the FDA advisory committee, and the FDA will, make the decision, and then it goes to a second advisory committee to the CDC, and they will decide on the appropriate indications based on the data provided by Pfizer. This is going to happen very fast. I know that the committees are already reviewing the data, and there's a huge effort behind the scenes to get this done as soon as possible. And this is very important, because if we can get kids 11 to 5 vaccinated, this will have a huge impact. Number one, will prevent infection from children and getting sick and infected their friends and the family members. So it's not only that we need to protect the kids, but we also that will help protect the whole community.
Doc, are there any questions parents should ask their children's doctors before deciding to get the vaccine?
Absolutely. The good thing is that pediatricians are very used to talk about vaccines, because it's something that we do every day in the routine care of kids. There is nobody better than the pediatrician to explain the details, how the vaccine works, how safe it is, and how important it is to protect children. So that's exactly going to be my advice. Talk to your pediatrician. They will be able to address all your questions and address the indications about the vaccine.
All right, Dr. Ramillo, thank you so much for sharing some information with us and taking time to talk to us today. We appreciate it.
It's always great to be with you. Thank you.
Thank you.